Question 26. A nurse is assigned to care for 4 clients. In planning client rounds, which client should the nurse assess first? A. A client scheduled for a chest X-ray. B. A client requiring daily dressing changes. C. A postoperative client preparing for discharge. D. A client receiving nasal oxygen who had difficulty breathing during the previous shift. Correct answer. D. Airway is always the highest priority, and the nurse would attend to the client who has been experiencing an airway problem first. The clients described in options 1, 2, and 3 have needs that would be identified as intermediate priorities. Question 27. A nurse employed in an emergency department is assigned to triage clients coming to the emergency department for treatment on the evening shift. The nurse should assign highest priority to which of the following clients? A. A client complaining of muscle aches, a headache, and malaise. B. A client who twisted her ankle when she fell while rollerblading. C. A client with a minor laceration on the index finger sustained while cutting an eggplant. D. A client with chest pain who states that he just ate pizza that was made with a very spicy sauce. Correct answer. D. In an emergency department, triage involves brief client assessment to classify clients according to their need for care and includes establishing priorities of care. The type of illness or injury, the severity of the problem, and the resources available govern the process. Clients with trauma, chest pain, severe respiratory distress or cardiac arrest, limb amputation, and acute neurological deficits, or who have sustained chemical splashes to the eyes are classified as emergent and are the number 1 priority. Clients with conditions such as a simple fracture, asthma without respiratory distress, fever, hypertension, abdominal pain, or a renal stone have urgent needs and are classified as a number 2 priority. Clients with conditions such as a minor laceration, sprain, or cold symptoms are classified as non-urgent and are a number 3 priority. Question 28. A new nursing graduate is attending an agency orientation regarding the nursing model of practice implemented in the healthcare facility. The nurse is told that the nursing model is a team nursing approach. The nurse understands that planning care delivery will be based on which characteristic of this type of nursing model of practice? A. A task approach method is used to provide care to clients. B. Managed care concepts and tools are used in providing client care. C. A single registered nurse is responsible for providing care to a group of clients. D. A registered nurse leads nursing personnel in providing care to a group of clients. Correct answer, D. In team nursing, nursing personnel are led by a registered nurse leader in providing care to a group of clients. Option 1 identifies functional nursing. Option 2 identifies a component of case management. Option 3 identifies primary nursing, relationship-based practice. Question 29. A registered nurse has received the assignment for the day shift. After making initial rounds and checking all of the assigned clients, which client will the registered nurse plan to care for first? A. A client who is ambulatory. B. A client scheduled for physical therapy at 1 p.m. C. A client with a fever who is diaphoretic and restless. D. A postoperative client who has just received pain medication. Correct answer, C. The registered nurse would plan to care for the client who has a fever and is diaphoretic and restless first because this client's needs are the priority. Waiting for pain medication to take effect before providing care to the postoperative client is best. The client who is ambulatory and the client scheduled for physical therapy later in the day do not have priority needs related to care. Question 30. A nurse is giving a bed bath to an assigned client, when a nursing assistant enters the client's room and tells the nurse that another assigned client is in pain and needs pain medication. The appropriate nursing action is which of the following? A. Finish the bed bath and then administer the pain medication to the other client. B. Ask the nursing assistant to find out when the last pain medication was given to the client. C. Ask the nursing assistant to tell the client in pain that medication will be administered as soon as the bed bath is complete. D. Cover the client, raise the side rails, tell the client that you will return shortly, and administer the pain medication to the other client. Correct answer, D. The nurse is responsible for the care provided to assigned clients. The appropriate action in this situation is to provide safety to the client who is receiving the bed bath and prepare to administer the pain medication. Options 1 and 3 delay the administration of medication to the client in pain. Option 2 is not a responsibility of the nursing assistant. Question 31. A nurse manager has implemented a change in the method of the nursing delivery system from functional to team nursing. A nursing assistant is resistant to the change and is not taking an active part in facilitating the process of change. Which of the following is the best approach in dealing with the nursing assistant? A. Ignore the resistance. B. Exert coercion with the nursing assistant. C. Provide a positive reward system for the nursing assistant. D. Confront the nursing assistant to encourage verbalization of feelings regarding the change. Correct answer, D. Confrontation is an important strategy to meet resistance head-on. Face-to-face meetings to confront the issue at hand will allow verbalization of feelings, identification of problems and issues, and development of strategies to solve the problem. Option 1 will not address the problem. Option may 2 produce additional resistance. Option may 3 provide a temporary solution to the resistance, but will not address the concern specifically. Question 32. A registered nurse is planning the client assignments for the day. Which of the following is the most appropriate assignment for a nursing assistant? A. A client requiring a colostomy irrigation. B. A client receiving continuous tube feeding. C. A client who requires urine specimen collections. D. A client with difficulty swallowing food and fluids. Correct answer, C. The nurse must determine the most appropriate assignment, based on the skills of the staff member, and the needs of the client. In this case, the most appropriate assignment for a nursing assistant would be to care for the client who requires urine specimen collections. The nursing assistant is skilled in this procedure. Colostomy irrigations and tube feedings are not performed by unlicensed personnel. The client with difficulty swallowing food and fluids is at risk for aspiration. Question 33. A new unit nurse manager is holding her first staff meeting. The manager greets the staff and comments that she has been employed to bring about quality improvement. The manager provides a plan that she developed and a list of tasks and activities for which each staff member must volunteer to perform. In addition, she instructs staff members to report any problems directly to her. What type of leadership style do the new manager's characteristics suggest? A. Autocratic. B. Situational. C. Democratic. D. Laissez-faire. Correct answer, A. The autocratic leader is focused, maintains strong control, makes decisions, and addresses all problems. The autocrat dominates the group and commands, rather than seeks suggestions or input. In this situation, the manager addresses a problem, quality improvement, with the staff, designs a plan without input, and wants all problems reported directly back to her. A situational leader will use a combination of styles, depending on the needs of the group and the tasks to be achieved. The situational leader would work with the group to validate that the information that the leader gained as a new employee was accurate and that a problem existed. Then, the leader would take the time to get to know the group and determine which approach to change, if needed, would work best according to the needs of the group and the nature and substance of the change that was required. A democratic leader is participative and would likely meet with each staff person individually to determine the staff member's perception of the problem. The democratic leader would also speak with the staff about any issues and ask the staff for input with developing a plan. A laissez-faire leader is passive and non-directive. The laissez-faire leader would state what the problem was and inform the staff that the staff needed to come up with a plan to fix it. Question 34. A registered nurse employed in a long-term care facility is planning assignments for the clients on a nursing unit. The registered nurse needs to assign 4 clients, and has a licensed practical, vocational, nurse, and 3 nursing assistants on a nursing team. Which of the following clients would the registered nurse most appropriately assign to the licensed practical, vocational, nurse? A. A client who requires a bed bath. B. An older client requiring frequent ambulation. C. A client who requires a 24-hour urine collection. D. A client requiring abdominal wound irrigations and dressing changes every 3 hours. Correct answer. D. When delegating nursing assignments, the nurse needs to consider the skills and educational level of the nursing staff. Collecting a 24-hour urine sample, giving a bed bath, and assisting with frequent ambulation can be provided most appropriately by the nursing assistant. The licensed practical, vocational, nurse is skilled in wound irrigations and dressing changes and most appropriately would be assigned to the client who needs this care. Question 35. A home health care nurse is planning client visits and nursing activities for the day. The nurse begins the visits at 9 a.m. All clients live within a 5-mile radius. List in order of priority how the nurse should plan the order of the assignments for the day. Number 1 is the first client or nursing activity for the day and number 6 is the last. Client assignment and nursing activities. A client requiring admission. A client being visited by the home health aide at 10:30 a.m. A client requiring supervision of the dressing change. The first dressing change for a client requiring twice daily dressing changes. A client with diabetes mellitus who needs a fasting blood glucose level drawn. The second dressing change for a client requiring twice daily dressing changes. Correct answer. 5, 3, 4, 2, 1, 6. The nurse would plan to visit the client with diabetes mellitus first and draw the fasting blood glucose level because this client needs to remain NPO until the blood is drawn. This client also would be unable to take any medication, such as insulin, until the blood is drawn. The nurse would plan to see the client requiring twice daily dressing changes next because the dressing changes should be spaced as far apart as possible. The nurse then would plan to see the client being visited by the home health aide and provide instructions and directions to the home health aide regarding care to the client. The nurse then would visit the client requiring supervision of the dressing change and would perform the admission next because that may take more time than the other clients. The nurse then would return to the client requiring the second twice daily dressing change.